Okay, one of the more valuable data sets out there in terms of air quality and human health is provided by the US EPA, and it's the National Air Toxics Assessment. The National Air Toxics Assessment, you can find it by Google searching it or going to epa.gov/national-air-toxics-assessment. Again, US EPA's primary mission is the protection of human health. Their mission is to protect human health and the environment in that order. And the NATA uses emissions data collected as part of the air quality permitting system, and then it uses that information along with what we know about weather phenomena, and heat and things like that, wind, to estimate health risk associated with air toxics that are released. And they've been doing this for a while, so this most recent release was from 2018 using emissions data from 2014. So this is the 2014 results, but there are data from 2005 and 2011. If you're to click on the 2014 NATA assessment results, you can get data for the entire nation for all pollutants. You can also do it for various individual pollutants. You can do it at the state level if you don't want to download as much information. They have data by how much is emitted by any facility, how much they expect or have knowledge on being emitted by the county, and they also include airports and various facilities. But the real powerful part from a human health perspective is they estimate cancer risk and hazard levels or hazard index levels for every pollutant, and then also the total cancer and total hazard index, or all hazard index. So if you want just the respiratory hazard from any particular pollutant, or the neurological hazard from a pollutant, or the liver, or the kidney, or the immunological hazard, they estimate it all, or if you want all of them combined. Also, they have the national cancer risk provided, and they break them down by source group, as in, like, is it a mobile source like an automobile, or is it more of a steady state point source type thing? When you download the data, you can download it by any particular individual pollutant, or you can do it for all of them, or you can download it by one pollutant. You can download all the data for a particular state. I've done this in the past with some students. There's various rows above this that I have to delete to make it into an Excel sheet for you to be able to sort. But if we were to sort this by FIPS code from A to Z, you could actually, this is the statewide levels, but once you get past the state ones, you get, to where you could actually pull this information and organize it by FIPS code, and then put that information up against the other FIPS codes from other data sets and combine this. But if you are interested, just using this for now, this is old data, 2005 data. If you were interested in seeing where's the total cancer risk the highest in the United States, 1.5 times 10 to the minus 4, so that's 1.5 cases per 10,000. So that's in New York City. So 1.5 cases per 10,000, 15 per 100,000, 150 cancer cases per million. And then with regards to where your cancer risk is the lowest, it's all the way down here at the very end. So looking at, I believe, about 7.4 cases per million in the Virgin Islands, I believe, and some pretty low ones in Colorado as well. If you were interested in the area of the United States with the greatest amount of cancer risk from any particular chemical, we'll just say like vinyl chloride, it's a derivative of trichloroethylene, the solvent. You can look at like vinyl chloride risk. A lot of counties there isn't any known risk, or it's really, really negligible. But then there are the counties that have the higher rates or highest risk levels, like way down here. Still, fairly low risk of cancer from the air. But again, it's in New York City, and then this one community in Henry County, Kentucky. Don't know much about that county relative to the ones I know about in the east. But anyways, this is the EPA's the EPA's National Air Toxics Assessment. So good data set if you're trying to look at risk from various cancer-causing agents, kidney disease agents, immunological agents, all those things. So that's all. So I'll stop here.